Plan G or Plan N? Which is better? This is Medicare Savings Solutions, and we will go over the differences between the Plan G and Plan N and help you decide which is the best route to go. If you look at this table, you will see that the Plan G and the Plan N are very similar. However, there are a few key differences. Looking at the Plan G, you see that there is only one gap in this coverage, and that is the Medicare Part B annual deductible. Currently, in 2023, the deductible is $223. What this means is that you would pay the first $223 in medical bills before Medicare, and your Plan G starts paying their portions. Once you've paid out the Medicare Part B deductible, Medicare Part B will pay 80% of the medical bills, and your Plan G would pay the 20% that is left over. So, to make it easy, you can see that the supplement Plan G picks up everything that Medicare doesn't when it comes to hospital coverage, and then, after the Medicare Part B deductible, it picks up everything that Medicare doesn't cover for medical services as well. After we explain the Medicare Plan N, I'll go over a couple things that neither of the plans cover. Okay, so what about Medicare Supplement, Plan N? The Plan N is also pretty straightforward, but there are a few key differences between that and Plan G. First, under the Medicare Supplement Plan N, you still have to pay the Medicare Part B deductible before Medicare or the plan will pay. Then you would have a $0 to $20 copay per doctor visit and $0 to $50 for an emergency room visit. Technically, it is the provider's choice whether to charge you the full copay or somewhere in between, but you can bet that they will ask for the full $20 or $50. The next difference that you can see in the table here is that the Plan N does not cover Part B excess charges. What are Part B excess charges? If a provider does not accept Medicare assignment, they can charge the patient up to 15% of the Medicare approved amount. Luckily, 98% of providers who accept Medicare also accept Medicare assignment. Because of this, it is very, very rare to be charged excess charges. So why would you go with Plan N over Plan G? Well, there are a few factors to consider when making this decision. First is the monthly cost. In most areas of the country, the Plan G runs about $30 to $60 per month more than the Plan N. If this is the case, then Plan N could be better if you aren't seeing a doctor more than 2 or 3 times every month. There are a few locations in the country where the plans are much closer in premium, say between $5 and $20 per month difference. When this is the case, it is a bit of a tricky situation. Many would choose to go with Plan G in this case because it isn't much more for a little more coverage and for the convenience of not paying a copay. The downside of this choice would come if you are in a state where you aren't able to switch plans without being underwritten or qualifying medically. I say this because history over the last few years has shown that the gap in premium difference between Plan G and Plan N continues to widen, and it will continue down that path in the future as well. So it may be a difference of $20 or whatever it is now, but 5 or 10 years down the road, it could be much more, making the Plan N a more affordable and sensible option at that time. The reason why the price gap continues to widen is because when people have guaranteed issue rights or opportunities to be able to go to a supplement plan without health questions, such as leaving employer or retiree coverage to join a supplement plan, they have the option to go to Plan G, but not Plan N. This means that the people who would not normally qualify health-wise for a supplement plan would go to the Plan G without question, and those people are likely in situations where their medical care costs much more, which in turn relates to higher increases in monthly premiums. So in order to go to Plan N, you've got to be new to Medicare or qualify medically, and most of these people would be maybe a bit younger and with less medical expenses overall, which leads to lower increases in premium compared to Plan G. All of this can be very confusing, and it can be hard to figure out where to go. Either way, our team can help you shop all of your options and assist you in finding the plan that is best for your specific needs. Please feel free to call 1-800-663-5707 for help with this, or if you need answers to any Medicare questions at all. Now I'll go over what neither plan covers. The Medicare supplement plans are only allowed to cover what original Medicare Parts A and B will cover. Since Medicare doesn't cover dental or routine vision, the supplement plans will not either. Also, Medicare only covers one full physical when you are new to Medicare. After this, they only cover an annual wellness exam, which is a shorter form exam. When you see all the ads that talk about dental, vision, hearing, and other additional coverages, they are talking about Medicare Advantage plans. We can help you look at those options as well and assist you in navigating all of this so you don't have to go crazy trying to get through it all on your own. Again, you can call 1-800-663-5707 with any questions you have.